Davis Family Hearing offers a free 30-day hearing aid trial. The initial appointment is completely free of charge. We do a full hearing examination with one of our board-certified doctors of audiology, a consultation to address your specific lifestyle needs, and then a free 30-day hearing aid trial. At the end of 30 days, you can either return or purchase the hearing aids. Call us today at 352-666-8910 or visit us at davisfamilyhearing.com.
Hey, good afternoon. Thanks for joining us on WWJB 103.9, 1450 AM. And, of course, you can also tune us in on 92.3 FM as well. Stream us online if you're sitting at your desk or at your computer. And, of course, always on the TuneIn app there on your mobile device. So welcome once again. I'm JW sitting at the helm. We've got a show prepared and ready to go for you. Once again, Davis Family Hearing. A show called Here Today, where it gives you an opportunity to call in and ask the expert. Dr. Joanie Davis is our expert. She's here for you. So give us a call here at the studio at 352-796-7272 anywhere across the Nature Coast, 1-888-613-2050. And, of course, streaming us online, www.jb.com. So without further ado, Dr. Joanie Davis of Davis Family Hearing. Their doctors do make a difference. They have 3 locations throughout the area. She is here for you, and you too can hear today with Davis Family Hearing. Welcome, Doc.
Thank you. Hi, John. How are you today?
Wonderful. It's a Friday. I'm glad you're in the studio with us, and always looking forward to what you're going to share.
Absolutely. Always a pleasure.
Yes.
Always a pleasure. I talked to you a little bit when I came in this morning. I've had an interesting week. It seems like wherever I go, everybody wants to talk about hearing loss. It's a much more common problem than anybody actually thinks. It's actually the 3rd most chronic condition in the United States after heart disease and arthritis.
No kidding.
So I went to a restaurant the other day, and I was sitting across from a table that was a real friendly table, and they started talking to me, and it turns out that one of the members at the table had tinnitus, or ringing in the ears.
Okay.
Can also be called tinnitus. And we started talking about some possible solutions and causes, and the table across from him was looking intently, and I apologized for being so loud, and he said, no, I'm really interested. I have that as well. I just got back from a health fair this morning, and that was the majority of the discussion that I had was tinnitus. So I thought it'd be a really good thing for us to talk about today.
Wonderful. Look forward to diving into it.
Well, tinnitus it can be ringing in the ears, it can be buzzing or whooshing, different sounds. It can even manifest itself as music. I've had people hear the same radio show over in their head again.
Hopefully it's here today.
Yes, exactly. I've had people hear Ave Maria or Christmas songs in their head repeatedly, and that's actually called musical ear. It's a form of tinnitus.
Okay.
But basically what it is, there's several different causes. It can just be something as simple as earwax or sinus problems, but more often than not, it's a little bit of nerve damage. So typically it's in the high pitches, but if you have a little bit of hearing loss, it can be a very common byproduct of hearing loss. And it's not abnormal for my patients to come in and say, I could hear just fine if it wasn't for the ringing in the ears, because that's so distracting for them. In reality, the reason they're having a difficult time hearing is because of the hearing loss, but they are really focusing on that ringing in their ears. What happens is it's kind of like if you had a limb cut off and you had a phantom pain, you have a little bit of damage to your hearing nerve. It's sending inconsistent signals to your brain.
Right.
And your brain is searching for the stimuli that it's used to getting that it's not getting. So when it doesn't get it, it generates its own signal, kind of like when you get a phantom pain from a removed limb.
Okay.
Unfortunately, there are a lot of professionals out there who tell their patients that there's nothing that you can do about it. And that's completely false. I treat tinnitus in my office all of the time.
Okay.
In addition, there are a lot of not pharmaceutical companies, but there are these companies that will come out with herbal medications, or I think Noisies or Quieties is one of them. And basically what they're doing is preying on people who are suffering because they don't do anything. Okay. So don't waste your money on any pill. There's no magic pill for it, but there is a lot that we can do about it. One thing that people with tinnitus are concerned about is that it's going to get louder. It never actually gets louder. It'll always go back down. But if you're stressed out, exhausted, anxious, dehydrated, or I've had a ton of sugar and caffeine and salt, a lot of times it'll sound like it's louder. And basically what's happening is your brain isn't as fresh, so it's having a hard time blocking it out.
Okay.
It's kind of like when you have a fan noise in the background and you're blocking it out, and you don't realize you're blocking it out until you turn it off.
Oh, okay.
So most of the time, hearing aids fix it. Most of the time, as soon as I turn a hearing aid on, it completely goes away. And it's probably one of the most fun things I do is to turn that stimulation on. What happens is the brain is paying attention to what's going on around you and can't hear the tinnitus anymore. Actually, as you wear it, I'll find most of the time over 2 or 3 months of consistently getting that stimulation, wearers take their hearing aids off. And if the tinnitus is still there, it's at a very low level. Now, if just the hearing aid itself doesn't work, almost all of our hearing aids that we fit now have tinnitus maskers in them. So what we can do is go in and program a specific stimulus right around exactly where the tinnitus happens. We actually measure it in the office, and it's a specific prescription. And over time, usually it takes 2 weeks to 6 weeks, they really start to notice a suppression in that tinnitus. I usually have my patients take some B12 vitamins in addition to it, some lipoflavonoid vitamins, because it does help increase blood flow to the ear while we're doing this. But the lipoflavonoid vitamins themselves don't just do it alone. I've tried to do that on its own, and it doesn't actually take care of it. That is a question I get a good bit. But tinnitus maskers have been extremely successful for us, and they're very cosmetically appealing. Nobody can see that you're wearing it. And we've had a ton of people helped and relieved from not having to hear that constant ringing in their ears anymore. I mean, imagine what that's like, hearing the most annoying sound on the face of the earth in your head, and nobody else can hear it.
Right.
So nobody else can empathize with why you're stressed out or snapping at your spouse or tense all of the time. And I've seen some very severe cases in my office. It's usually people who are pretty high anxiety, and it turns into kind of a vicious loop. They listen to it, and then they focus on it, and then they start to get anxious about it, and then it gets louder because they're anxious about it. And I can see some pretty severe cases. 90% of people push it into the back of their mind, but if there was a treatment for it, they'd be really excited about it. So that's what I wanted to say today. There is help. There is treatment. Don't let anybody tell you that it's not treatable, because it is.
You're going to the wrong people then if they're telling you that.
Absolutely.
Dr. Joanie Davis with Davis Family Hearing on a show called Here Today, brought to you every other Friday at 12 o'clock noon. Thanks for joining us and spending lunchtime with us. If you have a question for Dr. Joanie Davis, she is here live in the studio with us, and you can call us right here, 352-796-7272. Address a concern, maybe a comment, maybe you're getting ringing in the ears. They can take care of that. Once again, Dr. Joanie Davis just covered that, and we'll share a little bit more on that as well, I'm sure. But their doctors do make the difference, and Davis Family Hearing is the place for you. They got 3 locations, Brooksville, Spring Hill, and Newport Richey. We'll give you those before the end of the show, and how you can contact Dr. Joanie Davis at her office. But in the meantime, Doc, how... people that say they've been wearing hearing aids for years now, you're talking about this tinnitus masking. If that's something new, I mean, can somebody they can have this upgraded or something, I guess, or just replaced or what?
Absolutely. And that is why we always offer a free 30-day hearing aid trial, so they have a chance to experiment with them.
Okay.
Tinnitus maskers existed a long time ago, but they were big and bulky, and they weren't a hearing aid in addition to it. Because remember, most of these people who have tinnitus have a little bit of hearing loss as well. So we're playing double duty with it. Now, hearing aid manufacturers have jumped on the ball, and almost all hearing aids have a masker in it because it's such a common disorder. We always try the hearing aid first, just the straight stimulation and amplification. And then if that in itself doesn't suppress it, probably about 50% of the time that takes care of the problem, then we can go ahead and start working with the masker and get a specific prescription. And most people, if there's anything that you can do to get rid of it, they're thrilled.
Right, exactly.
And this is why I only hire doctors of audiology, because you can just go to a hearing aid salesperson, and most of the time they're not even aware that this is even in the hearing aid. And if they do, they might just turn it on and not actually prescribe it right around the person's specific prescription. You can just turn something on, but if you just, it's kind of like readers for eyeglasses. If you're vision progresses to a point where you need a specific prescription, you're going to have to go to an eye doctor. It's the exact same scenario. A lot of places shy away from tinnitus because it is difficult to treat, and it is just a little bit more challenging to treat. And that is why I only staff doctors of audiology, because I want my patients to get the highest level of care possible.
Yeah.
We work with all hearing aid manufacturers, all cochlear implant manufacturers, and we have a solution for everyone. We make sure that we educate ourselves to be knowledgeable on every product and treatment that's out there, so we can really assess the patient when they're in front of us and make sure that we have the appropriate solution and treatment for them.
Well, I'm glad you brought that up, because there are so many different choices out there, and there is a difference between hearing aid locations or stores, I guess you would call them, and audiologists. I mean,
yes,
yeah,
okay. Absolutely. I call them hearing aid stores. I'll never, ever forget when I opened my practice. I had somebody ask me if I was going to go for the medical model. And I said, what other model would I go for?
Right.
I'm a doctor. But unfortunately, there are people who are not quite as qualified to treat hearing loss. And a lot of times I see these people's patients in my office reprogramming their hearing aids to get the correct prescription in them. There are some really nice people out there. Hearing aid specialists have a high school education, and they undergo a 6-month apprenticeship underneath another hearing aid specialist, and that is the training that they have. Doctors of audiology have gone to school for 8 years to get our doctorate degree. So there's a whole different level of care that you're going to get. And it's also going to be a different experience when you walk through the door. We're here for the patient. We're here to address your specific problem, no matter what that is, regardless of what it costs. It could just be something as simple as cleaning your hearing aid to fix your problem. And I get reports. Like I said, I was at that health fair this morning, and I had multiple people come up to me and say, well, I went to this place, but it was just so uncomfortable. It was high pressure sales and pressure, and only gave me high dollar items. And that is not what it should be about.
Right.
I mean, this is a medical device. This is your body. It should be relaxing. You should feel open to be able to discuss all aspects of your hearing loss, even down to how it affects your relationships with your family members and your friends, because those are all considerations that we talk about whenever we're choosing the specific treatment for you.
Right.
And I always say, I want you to get the highest level of care possible, but I want you to feel like you're at home while you're doing that and you're a member of the family. I had to laugh yesterday because Dr. Perkins, one of my other doctors, was chuckling, and she said, saw one of your patients this morning and gave him a fist bump whenever he walked out. And he looked at me all disappointed and said, well, whenever Dr. Davis fist bumps me, she explodes it afterwards. So we even have specific handshakes for patients when they come in, because it really does turn into a relationship, because this is a long-term treatment option. And that's something that a lot of people don't know.
Right.
And then you get the problem of people feeling like hearing aids don't work, or that everybody's out just for your money. And that's not what you're going to experience at Davis Family Hearing.
Yes, I'm glad you made that difference there, differentiated between the store, which, the big box store, compared to Doctors of Audiology. It does make a difference. You wouldn't go to a walk-in clinic if you needed surgery. But the professionals, just like Dr. Joanie Davis here in the studio with us with Davis Family Hearing, she is the professional in the studio with us today. We bring her to you because we know her, we trust her, and we trust our listeners with her. So we'll be back. We'll take a quick break. This is, of course, a program called Here Today with Dr. Joanie Davis, Davis Family Hearing, brought to you by JB Radio. Your chance to call in with a question, comment, or concern. 352-796-7272. We'll be back with a short message from our sponsor right after this.
Are you a candidate for a cochlear implant? Sometimes hearing aids just aren't enough. If you're still struggling on background noise or hearing your loved ones when they're not looking at you, even when you're wearing your hearing aids, a cochlear implant may be an option for you. To find out, call Davis Family Hearing at one of our 3 convenient locations in Spring Hill, Brooksville, or Newport Richey, or you can visit us on the web at www.davisfamilyhearing.com. Davis Family Hearing offers a free 30-day hearing aid trial. The initial appointment is completely free of charge. We do a full hearing examination with one of our board-certified doctors of audiology, a consultation to address your specific lifestyle needs, and then a free 30-day hearing aid trial. At the end of 30 days, you can either return or purchase the hearing aids. Call us today at 352-666-8910 or visit us at davisfamilyhearing.com.
And we're back. Once again, Dr. Joanie Davis is in the studio with us. She's here for you. If you have a question, comment, or concern, 352-796-7272. We will address that on the air. If not, you can always reach her offices. Got 3 of them here, but I'm going to give you one in Brooksville, 352-666-8910. That's on Cortez Boulevard, State Road 50, just a little west there of the Withlacoochee River Electric. Also, Spring Hill in Newport Richey. Once again, 352-666-8910 will get you to Davis Family Hearing. So, Dr. Davis, I understand you have a 30-day trial period. Does that include all hearing aids? Like I've heard of this one called Lyric.
Absolutely. Every device that you try in our office is free for 30 days because we want you to have an opportunity to make sure that it's working for you before you make any decisions. Mm-hmm. The Lyric is a huge hot topic right now, and there's multiple reasons for that. Hearing aids are not your mother's hearing aid anymore. I always like to say that because a lot of times there's a stigma of a big, bulky, squealing thing that people turn off when they don't want to hear whoever's talking, and that's not what we're working with these days. One of the most interesting hearing aids that we're fitting a ton of right now is Phonak's Lyric hearing aid, and it's actually an extended wear hearing aid that we put very deep into the ear canal. It's 100% invisible. You can't see anything about it. And it doesn't come out for 2 to 3 months at a time. So there's no cleaning. There's no battery changing. There's literally nothing to think about. And as a result, my patients walk around feeling like they don't have a hearing loss and they're not wearing a hearing aid. I mean, the amount of confidence I see on these people's faces because they know that no one can see their hearing aid and they're hearing great is just a priceless thing. Mm-hmm. I always say my number one goal is that you hear better, but my number 2 goal is that nobody sees why you're hearing better. You can shower with the Lyric, you can swim with the Lyric, you sleep with the Lyric. It literally does not come out, and about every 2 to 3 months the battery dies. Mm-hmm. So my patients come into my office, I remove it and put a completely new device in with a fresh battery. There's only one Lyric provider in Citrus, Hernando, and Pasco County, and that's Davis Family Hearing. I was
going to say, let me take you guess who that is.
That would be us.
Very good.
And, it's a very intensive training that we went through to be able to fit this device. The manufacturer is very picky about who they choose because we're so deep in the ear canal, but it's very comfortable. I always say it's kind of like wearing a watch. When you first put it in your ear canal, you may or may not be aware that it's there. And then after a couple of hours, it's just like there's nothing in your ear. And I find the people who do the best with this hearing aid are my business professionals who don't want anybody to see their hearing aid. I went to a chamber breakfast on Wednesday morning, and one of my patients and friends, I was sitting there talking to her, and she's so stinking cute. They're invisible, and as soon as she sees me, she always wants to talk about how she's hearing. And she was like, "Oh my goodness, I'm hearing so well. This is fabulous." And we were talking to another professional, and everybody wants their hearing aid to be invisible, but when they're happy with it, they talk about it. And she looked at her and said, "I got new hearing aids. You can't see them, can you?"
There you go.
So I find that my patients are bragging about their hearing aids these days. And the other profile, other than a business professional, is the person who just doesn't want to do anything with their hearing aids. I have several, and a lot of times they're over 90 years old, and their family brings them into me, and they may have dementia, and they're losing their hearing aids, and they can't keep them in their ears, or they're just tired and don't want something else to have to care for, or, they don't continuously use their hearing aids or put them in, and this is a way for them to hear 24/7 and for their family members not to get frustrated because they're not hearing. And it's a 15-minute appointment for every 2 to 3 months for me to put a new fresh battery in the device, and it's just worked really, really, really well for our office. I found what ended up happening was for those elderly patients that didn't want to do anything with their hearing aids, You don't have to be elderly, but I find that that's typically the personality profile that really enjoys them. It's not a big deal for them to come in for 15 minutes and their family is through the roof happy, because otherwise they wouldn't have worn their hearing aids. And that's also what's happening with my business professionals. They otherwise wouldn't have worn something that could have been seen, but since they're 100% confident that it's invisible, they walk around with a ton of confidence, knowing that they can communicate better and nobody can see why.
And that happens more often than you think. I mean, the loss of hearing aids, or just not tuning them correctly or caring for them properly. And I see that this lyric, of course, Davis Family Hearing, the only provider in the area that will give you lyric hearing aids. That's the world's first and only 100% invisible, 24/7 wearable, shower-proof for months at a time hearing aid. And I believe it's also Bluetooth.
This one is not. Actually, this is very interesting. The lyric is a very natural sound quality. And the reason is because it's an analog hearing aid.
Okay.
And that always blows people's minds, because they're like, analog, that's old technology. But the truth of the matter is analog is a very clear, natural sound.
Yes, it is.
And the reason that it works is because it's 4 millimeters from the eardrum, so it mimics your natural hearing. Digital hearing aids have to treat sound digitally. And while digital hearing aids are excellent, I find if somebody's not doing well with a digital hearing aid for any reason, the analog hearing aid really takes care of it for them. It's the only analog hearing aid out there, but it's a very natural, easy way for people to hear. Bluetooth has to stay in the digital world.
Yes, you're right. You bring up a great point. I appreciate that, especially being in radio, going through the process over the years, going from the vinyl to the 8-track to the tape deck to now we're in the digital age, and it's just not the same. It's not like going to a live concert or hearing it on a vinyl record, and just you get that digital aspect of it. It sort of throws it off a bit, but the technology is continually increasing and getting better as we go. So,
but on the converse of it, my digital Bluetooth hearing aids help you hear better than a normal hearing person when you're on the phone, because you're streaming phone calls directly to 2 hearing aids. You can manipulate your own settings on your cell phone. And the point I'm trying to make is one product doesn't fit everyone. We're all individuals, and I've had people try the Lyric and the Bluetooth hearing aids, and half will go with the Bluetooth hearing aids and half will go with the Lyric. It's an individual choice, and that's why we do a free 30-day trial, so you have a chance to experiment with all of this crazy technology that we play around with every single day.
Very good. We have about 2 minutes left, Doc. Dr. Joanie Davis with Davis Family Hearing, a show called Here Today on JB Radio every other Friday from 12 to 12:30 live. Your opportunity to ask the expert. Dr. Davis, tell us just briefly, we've got a minute and a half left, the products that you carry and how our listeners can get in touch with you.
Absolutely. We don't only work with hearing aids. We see newborns all the way up to geriatrics. So if you're concerned about your baby's hearing or your child's hearing, absolutely give us a call. If you are concerned that your school-age child has an auditory processing disorder, we diagnose and treat that as well. We work with hearing aids. We work with cochlear implants. We work with tinnitus. We literally treat every possible hearing disorder out there. And I have 3 doctors and 2 residents on my staff. So we have plenty of people to accommodate everybody coming in. You can give us a call at 352-666-8910. That actually goes for all 3 offices. It routes into a call center. You'll speak with Jennifer, my very, very, very sweet, accommodating, wonderful to talk to appointment scheduler.
Hi, Jennifer.
And if you want more information on any of these products or to meet our doctors, we have bios and pictures, and we just took pictures yesterday to get all of our staff up there so you know who you're talking to and dealing with. Visit us online at davisfamilyhearing.com. Okay, so connect to hearing, connect to health, connect to life, and you too can hear today with Davis Family Hearing, brought to you by JB Radio, second and fourth Friday of every month. And hope you tune in next time, 12 to 12:30. If not, give Dr. Joanie Davis a call. Of course, her staff is ready to help you and to assist with your hearing needs. 666-8910. It's been a pleasure, Doc. Thank you so much. Have a wonderful weekend.
Thank you. You too.
Bye-bye.